name is Catheter. I will be your nurse for today. I am going to wash my hands before I get started. Can you please tell me your name and date of birth? Okay, that's correct. Before coming in here, I did verify your chart for the doctor's order, for any physical limitation, and I verify your allergies to medication, but I am going to ask just to double check. Can you please tell me if you have any allergies to medication, latex, or iodine? Okay. Do you have any difficulties or any problems getting into a position that probably gives you some pain or discomfort? No? Okay, so that's good. The doctor did prescribe, he ordered an indwelling catheter, and that is it's a small tube that goes into your bladder, and that will relieve the pressure you have in your belly, and that will help you to empty out your bladder, like that you could be more comfortable. Do you have any questions or concerns about the procedure? Okay, so before I get started, I am going to adjust the bed to a good working height. I am also going to help you in the position. So my patient is going to be laying in supine position on her back. Legs, her knees will be flexed 2 feet apart. Okay, 2 feet apart. I'm gonna elevate you a little bit. Are you comfortable? Okay. Since my patient doesn't have any physical limitations, I am not going to be needing a staff for this procedure. Since there's good lighting, I am not going to need a flashlight. And we're going to get started. Do you have any questions or concerns? I'm going to put the Cyril up as I get the stuff just to clean your labia and your perineal area. That will help to reduce the spread of microorganisms, which can lead to an infection. So we're going to reduce that. I am going to clean my hands. I'm going to put some gloves on. I will be using some wipes. They might feel a little cold. My side table is clean. This is a blue pad. It's going to go underneath you. Can you please lift up your buttocks? Thank you. I'm going to put down the Cyril since I'm already here. And I am going to clean. I am going to spread your labia using my non-dominant hand. You might feel some coldness. I will spread it, clean from top to bottom. Throw it out. I will go to the other side of the labia. Top to bottom, throw it out. Now I'm going to clean the center from top to bottom. Are you okay? So now we're done cleaning. I am going to clean my hands. Then I'm going to get my Foley catheter, the tray with all that stuff. As I do the procedure, I will be asking you just to lift up your buttocks, just to put some trays underneath you, just to make sure that, everything gets put in the right position. I clean my hands again since those gloves have like powder. And I am going to get the Foley tray. I will cover my patient, lift up the Cyril. And I'm just going to get the tray. I'm going to remove the bag. Get rid of the bag. Using the corners. I am going to be using this, and this is going to go underneath my client. Can you please lift up your buttocks? The shiny side will go down. I am going to remove my gloves, and I am going to transfer this over here. I am going to put this between your legs. Please make sure you don't touch it. I'm going to put my gloves. Are you okay? Are you comfortable? I'm going to go underneath the cuff. Making sure my thumb is out the way. I am going to put the fenestrated drape, only exposing the labia. I am going to open the iodine, pour it on the cotton balls, and then get rid of it. I am also going to pass this over just to verify all my supplies. I have saline. I could just get rid of it. I'm going to attach this to the port for the balloon. I am going to open my lubrication, and I will be pouring that in the tray. I am going to lubricate about 1 to 2 inches of the catheter. And I'll put it right there. I'm gonna let that soak in. I'm going to spread your labia using my non-dominant hand as I clean your labia with the iodine. So I'm going to use my hand to spread. I am going to clean from top to bottom. Clean the other side of the labia, top to bottom, and get rid of it. Last but not least, I'm cleaning the center, top to bottom, and get rid of it. Get rid of that. And the catheter is already lubricated, so I will be inserting it about 2 to 3 inches first. If I were to need any resistance, I would just move it slightly around, and once it's okay and comfortable to go in, I would insert it 2 to 3 more inches. Once I reach the desired area, that is when I will inflate the balloon. So now I am holding the labia, going to insert it. Please take a deep breath. So I'm inserting it. I'm inserting it. Now once I see the return of urine, that is when I will stop and I will inflate the cuff, the balloon. And then I can get rid of that. So now I am going to pull back just to make sure that there's resistance and that the balloon is not going nowhere. So it's in the right place. I'm just gonna close this since it's a bottle. I don't want it to go nowhere. And then with this, I will make sure that it goes below the patient's bladder. Since this bed doesn't have a hook, I'm just gonna pretend it is on the appropriate place. So it is below the patient's bladder and it's secure. I'm gonna try to close it like that. It's secure. So everything's done, and I am going to get rid of all the supplies and get rid of it and get new pairs of gloves to attach the catheter to the patient's thigh. I will make sure to leave some slack like that for leg movement. So I am going to get rid of everything and dispose it to the right place where it belongs. According to the facility, I will be removing my gloves, and if I were to need a specimen, I will get new pairs of gloves. Obviously that will go in the trash. So I'm going to clean my hands. I will get a new sterile glove, and I will be attaching that to the patient's thigh. And if I were to need a specimen, I will use alcohol pad, so I did attach this to the patient's thigh, make sure that they had some adequate movement, and I will clean this port with alcohol, allowed it to air dry. I will use like a 10 milliliter syringe, and if they need more than that, then I will just pull back twice. So then I will just pull it and make sure it goes in there. Once that's done, I will make sure that it has the patient's name, date of birth, and all that information that's required. And then I will send that to the lab. I will make sure that there's no kinks or twisted tubing, that everything is flowing right. I will make sure that everything is good. I will adjust the bed to a lower position, give the patient the call bell, cover my patient. For documentation, I would document the time of the procedure, the catheter, which catheter I used, document the patient's color for the urine, the clarity, and how much it came out. I will also document the patient's response to the procedure. The patient tolerated the procedure well. There was no adverse reaction. The patient's abdomen is not distended, and patient tolerated well.